Olubiyo. I'm an ST1 in emergency medicine at Southend Hospital. To be frank, I'm looking at a career in interventional radiology. And usually I have the habit of just picking up new skills. And coupled with the fact that I work in the emergency department now, it becomes important to really know things that helps patients' day to be very reduced while we take very good care of them. So I picked up this course, first of all, because I knew it will help me in emergency medicine now to make quick diagnosis, help my patient leave the hospital as soon as possible. Having taken very good care of them. And then plus in the future, it's going to add to my portfolio as it relates to going into radiology eventually. So either ways, I win. And that's the reason I came here. Everything has been quite helpful. Before now, when I look at ultrasounds and, images from ultrasounds, sometimes it's so confusing. Usually what makes the difference is your ability to know what you're looking at. The human body is really complex, yeah, but images like this would help you know where and what you're dealing with. So I would say every aspect of today's teaching has been really helpful. As much as I would say it's the ligament part that had me looking again, like, what is that? But the faculties have a way of, helping you stay relaxed and really make sense of what you're looking at. So it's been beautiful, challenging, yeah. But with the amazing faculties, the challenges are amazingly dealt with. So I'm hoping that after today, I'm scanning all the way. Well, of course, emergency medicine, yes. Doctors in the emergency department will benefit a lot from this because we tend to see a lot of, these presentations, trauma-related, infections-related and all. So yes, emergency medicine, orthopedics. Yes, orthopedics doctors, physiotherapists, doctors in MSK clinics. And GPs. Yeah, GPs actually. So yes, I think maybe everybody, you just have the habit of adding something to what you already know. Okay. Well, I'm a bit new to the UK. But before I came to the UK, I've had amazing teachings with my consultants in Nigeria on ultrasound courses. But they've been in-house teachings. But yes, I've had loads of trainings. And then, of course, coming to Southend Hospital, once in a while, you need your senior colleague to supervise or help you with seeing certain cases, especially because we see loads of elderly people, who would come in with fractures and all of that in the ED. We would usually, it's a thing we see every day, that's fractures. So we tend to scan, especially the neck of femur fracture. We see that like every day. And one of the management pathways for you to do a FEEB, that's a block, just to help the pain control. So yes, we do that every day. And if you're lucky enough to see that patient, you need to do the FEEB. And to do that, you need a senior colleague to be with you. And so I would say almost every day you get to have to scan somebody. So yes, I've had previous trainings as it is, but maybe not something this official. I should be frank. It's just like in-hospital trainings. Yeah. Well, honestly, when it comes to any training, a bit of something would usually help you to understand it, regardless of the kind of training. So if you already have the background and then you're learning something new, it's easy to build on what you've learned before. But because faculties here, well, they kind of help you even if you've not had previous experiences, so they're telling you this is what this looks like. It's easy, but I'll say it's going to be easier if you already have a background to ultrasound before coming for a course like this. Of course I will. I will anytime. I will recommend it to everyone. And well, sometimes action speaks louder. So I want to believe that if I get back to my hospital and people see me do this and then I come with really positive findings, before this patient goes for x-ray, I could already tell there's a fracture. I think we need to do this already. And then patient goes for x-ray and it's what I'd said. I wouldn't have to even tell someone that, okay, there's a training you need to go for. Once they see that you can make a difference because you're able to do this, it's only normal for people to then approach, oh, how did you get that? And then I can boldly say, well, I went for this training and that's where I picked the skill from. So I want to believe that, yes, I will speak by mouth, but I'm hoping that what I'll be able to do after today would help to tell someone that they should come for this course.